Why do stroke medications cause GI problems? Imagine your body as a finely tuned machine, with your digestive system working smoothly in the background. When a stroke occurs, it can disrupt this harmony, especially in how your body controls digestion. Many stroke medications can add to this disruption, leading to gastrointestinal problems. One key reason is that stroke often damages parts of the brain that regulate the autonomic nervous system, which controls involuntary functions like digestion. When these areas are affected, the signals that tell your stomach and intestines to move food along can become impaired. This can cause delayed emptying of the stomach, known as gastroparesis, or lead to constipation and difficulty swallowing. Medications used after a stroke can sometimes worsen these issues by interfering with nerve signals or muscle coordination in the gut. Many drugs given during stroke treatment have side effects that directly impact the gastrointestinal tract. For example, blood thinners or antithrombotic medications are essential to prevent further strokes but can increase the risk of gastrointestinal bleeding. Calcium channel blockers, often used to control blood pressure, can relax the muscles in your intestines, leading to constipation. Steroids and non-steroidal anti-inflammatory drugs are also common in stroke care and can irritate the stomach lining, increasing the chance of ulcers or bleeding. These side effects are well documented and are part of the reason why managing medication side effects is so important in stroke recovery. Furthermore, stroke patients often already have some degree of gastrointestinal vulnerability. The stroke itself can impair gut motility, increase intestinal permeability, and cause inflammation. When medications are added into the mix, they can worsen these pre-existing conditions. For instance, some drugs may alter the balance of bacteria in the gut, leading to dysbiosis, which can cause symptoms like diarrhea or bloating. The disruption of the gut-brain axis, which is the communication pathway between your brain and digestive system, also plays a role. When this axis is disturbed by stroke and medication effects, it can lead to further issues with gut health and function. In the context of acute stroke care, managing these gastrointestinal side effects becomes even more critical. Problems like bleeding or severe constipation can complicate treatment and recovery. For example, if a patient develops gastrointestinal bleeding, doctors might need to adjust or pause certain medications, which could impact stroke prevention strategies. That's why healthcare teams carefully monitor for symptoms such as nausea, vomiting, bleeding, or constipation. They may recommend dietary changes, medications to promote gut motility, or protective agents to shield the stomach lining. In summary, stroke medications cause gastrointestinal problems because they interact with an already sensitive and vulnerable digestive system. Their effects can irritate the stomach, slow down or speed up gut movements, increase bleeding risks, and disturb the microbiome. Recognizing these mechanisms helps healthcare providers develop strategies to minimize side effects, ensuring that stroke treatments are as safe and effective as possible. Always remember, if you or someone you care for experiences GI issues during stroke recovery, consulting a healthcare professional is essential for personalized care and management.